Hey everybody, it's Curtis coming to you from the Premier team. We have a webinar for you today. Today is the Facebook Live webinar series Fridays. Today's topic is Kinesio Taping. Let me just see if I posted this to the right page. See if we're up and running. But yeah, today is Friday. Christmas is in T-1 week. I hope you're ready. I'm not, but I'm close. All right, looks like we posted this to the right page, so let's get this rolling. So, kinesio taping, if you come to our clinic, you have seen us use this before. Let's see. And usually we try to do a good job of explaining its uses, but sometimes I just put it on somebody and I forget to explain to them what the tape is actually doing. So, the tape really first got on the scene during the 2008 Summer Olympics. The volleyball players were wearing all this tape on their shoulders, on their bodies, on their knees, and it really caught notice. Everyone's like, "What is this tape?" And then it really caught on in physical therapy. Started using it from there. So the inventor is a guy named Dr. Kenzo Case, and he's the founder and inventor of Kinesio Tape. And what he did was he was kind of frustrated with all the current taping out there because most tape, you put it on the skin and you can't move. So he wanted to find something that you can put on the skin that actually moves with the body so you wouldn't be restricted in your range of motion. So he invented a texture and elasticity that closely matches the skin, and the result was amazing. Um, so how does it work? Because that is the question. The results have been amazing, but how does it actually work? So a lot of it still hasn't really been proven yet. But they say if you put unstretched KT tape over the skin, it causes the skin to form convolutions. These are little wrinkles in the tape that lift certain areas of the skin. So what this does, it decreases pressure and decompresses the nociceptors, leading to decreased pain. So nociceptors are receptors in your body that would tell you if there's pain. You have other receptors in your body that can tell you if there's something touching your skin, if there's pressure on your skin, if your muscles stretching, if your arms moving, things like that. So it takes the convolutions form a little hill that takes pressure off the underneath tissue. So that's why they think it helps with pain, but they also seem to have uses for circulatory and lymphatic issues. So I got this from the kinesiotaping.com website, but it says that the KT tape alleviates discomfort and facilitates lymphatic drainage by microscopically lifting the skin. So again, it's going to talk about the convolutions helps with the pain, but also these convolutions help with increasing the interstitial space, allowing for decreased inflammation, reduced pressure, and more effective lymphatic flow. So here's a picture. It shows the thin tape over the thin epidermis tissue, and then you have your dermis underneath that, layers of fat, muscle, and you got lymphatic fluid in there, you got blood vessels in there, receptors in there. So you can see all the layers. But these little hills right here, the ones that go up, that's the convolution right there. So this area is lifted up, this area is lifted up. And you can see you can take some pressure off the underneath surface. Here's the interstitial fluid that the previous slide was talking about. It decreases pressure on it. So basically, intracellular fluid is fluid in your cells. A lot of the red blood cells, for example, look like a donut, and there's water being exchanged and other things constantly through the cell membrane itself, which is the membrane around the cell. But then the cell itself floats in the interstitial fluid, which is all this fluid outside. Well, here's the category extracellular fluid. So outside the cell, you have blood vessels, which have a capillary wall on it. So the capillaries are very small areas of your blood vessels that make the transition from arteries to veins. So that wall is right there, and the cell membrane wall is right there. Uh, and in between the two, between your blood vessels and your cells, is all this interstitial fluid floating around there. But I mean, the proof is right there. We've done this on people that walk in the clinic. The most obvious sign that something is going on with this tape is if you have a big bruise or contusion, you can put the tape on in the web pattern. And we've done this on a lot of patients in the clinic here. And when you take the tape off a couple of days later, the bruising underneath the tape is gone. Like, this is almost like magic. So you know the tape's doing something if it's causing that effect on the bruising. And then we also use it on muscles too. So the tension on the tape can either facilitate or inhibit a muscle. So they say to inhibit a muscle, you want to attach the tape from the insertion of the muscle to the origin of the muscle. So for the calf, for example, you would start at the bottom near the Achilles and work your way towards the knee or the top of the muscle. And the reason why you'd want to inhibit a muscle is if it's overacting, guarding, um, then you would want to try to get it to relax. Then you can facilitate a muscle by attaching it from the origin to the insertion. So this could be used to facilitate or make a muscle work more effectively. The tape has elasticity to it, so if you the muscle in nature contracts and relaxes. So if you have some pulling of the tape on your muscle, it will assist the muscle, make it easier for the muscle to work. Different types of shapes with the tape. So some people on their shoulder might get a Y strip. Some people on their back might get an I strip. Some people on their shoulder blades might get an X strip. They'll have a little bit of different functions depending on what body region you're in. The web ones, as I showed you in that other picture, really help with swelling and bruising. It all depends on how much you stretch the tape, really can affect your treatment too. If you do a full 100% stretch, that might not allow the muscle or the area to move too well because it's so tight. If you do a light stretch, you just kind of place it on your body, that can really allow you to move without any discomfort at all. And then you can use some of these other ones in between to help muscles work a little easier with the assistance of the tension. But be careful if you're trying this at home. If you have very fragile skin that gets cut really easily, you might not want to put this on the skin because you have to rip it off the skin eventually, and it could irritate the skin. If you have some kind of cellulitis infection or something like that, skin infection, you might not want to put it on that. It's not like a band-aid or anything. So, and then open wounds, like I said, it's not a band-aid, even though some look like a band-aid. So it would only irritate the wound when you took it off the skin. So short and sweet. It's just a small PowerPoint today, but here's the references. You can go to kinesiotaping.com and look those up. But other than that, if there's any questions, I'm going to look up to see if there's any comments here. See if we're up and running. Looks good. So other than that, thank you again for tuning in. And we are out. Catch us in the future with more videos that we're going to be posting in the future. All right. Have a good day.